Fatini. I'm a chief resident and pediatrician at Mayo Clinic.
Hi, I'm Rana Chakraborty. I'm a senior associate consultant in the Department of Pediatrics and Adolescent Medicine and a professor of pediatrics, also here at Mayo Clinic.
And today we're going to be talking about a review paper entitled Acute Flaccid Myelitis, a Clinical Overview for 2019.
So, with that, this has been a perplexing problem. Maybe, yes, you want to talk a little bit about sort of the epidemiology and what's going on, not only regionally in the Minnesota region, but also nationally.
Yeah, so nationally we've seen an increase in acute flaccid myelitis throughout the nation, several states, and particularly in the year 2018 we had a threefold increase compared to 2017. And over the past several years, since about 2012, we've seen kind of these outbreaks of acute flaccid myelitis occurring in several year periods for unknown reasons. And because of this, there's been increasing interest into what's causing this syndrome and how we can treat it.
And this is particularly important because in our practice it's affecting children mainly nationally, and I think we're a little bit perplexed in terms of what the pathogenesis is, and there's only a limited amount of research that's sort of gone in right now in terms of characterizing some of the children and adolescents that have been affected by acute flaccid myelitis. There's been some association potentially with enteroviruses. Two in particular get highlighted and have got highlighted in the outbreaks: enterovirus D68 and enterovirus A71. But the work is still somewhat limited in terms of what we understand, and unfortunately that also means that we don't quite yet have the evidence base in terms of providing the optimal guidelines in terms of management. Now I know you've seen or observed a few potential cases. Maybe you'd like to talk about that experience.
Yeah, so we've had some potential cases of kids presenting with limb weakness that's been concerning for acute flaccid myelitis. And oftentimes this presents a few weeks after a respiratory illness of some sort of viral illness, and that's usually when this is suspected. But we can confirm the diagnosis with MRI imaging, or sometimes we also use CSF results too. On MRI you can see some hyperintensity in the gray matter of the spinal cord, and that's shown nicely in a couple of these images as well. On the CSF you can see increased or CSF cytosis, or increased white cells, and some protein. And so that's typically how we've diagnosed children on our service. Of course, we then report these cases to the CDC and to the state health department. But really, as you were pointing out, Rana, in terms of management, that's been quite difficult because the options we have, we don't have much data for. So we have tried things like steroids or IVIG. There is some in the literature about plasmapheresis, although I've not personally used that. And then there is also some literature on fluoxetine. All of these are options, but none of them have been proven to be efficacious, unfortunately. And in our practice, we, in the couple cases of probable or possible acute flaccid myelitis, we've used IVIG typically in order to avoid steroids and a possible concurrent infection and that worsening. But again, we don't really have a great answer for why this happens, how to treat them, these patients, and really what the long-term outcomes look like.
And that's a really important point that you're sort of ending up on, which is the long-term outcomes. And it's still unclear, at least looking at the literature, whether these children make a complete recovery or not, and what other potential aspects of morbidity affect them as a result of this condition. And that, again, requires more prospective, long-term studies to address the specific issue.
Right. So, as we've discussed, Rana, it's acute flaccid myelitis. In many ways, is kind of scary because it very much resembles poliomyelitis that we have seen in the past with epidemics, and of course we have a polio vaccine to help prevent that, but we're not entirely sure what's causing this similar syndrome that does not appear to be caused by the polio virus, but we're not sure what's causing that, whether it's a viral etiology or not, although it does seem to be. And because of that, we need a lot more research and investigation to look at both the etiology, pathogenesis, and then also treatment and management.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.